All right, welcome to the program. In case you're just joining us, it is Wednesday. Health and Lifestyle begins right now. But if you're with us since morning, thank you so much for choosing Daybreak to wake you up and to update you on what's happening in Kenya and beyond borders this morning. Let's talk matters health. Let's talk matters lifestyle. And today it's all about eye health. And our focus is on vision and vision loss. And this morning I have an expert doctor with me in studio and also somebody who is really understanding what it means to undergo this experience of losing your vision and trying to navigate just this new lifestyle. I'm talking about Vivian Seleina. Vivian is with me in studio this morning. She's an empowerment coach. Thank you so much for creating time, Vivian. Vivian, like I told you, is somebody who understands what it means to lose your vision. It is something that happened to her in her adulthood, actually, and she will be telling us how it has been transitioning into this new version of herself. Asante, Vivian, once again. And we have with us in studio Dr. Priyanka Buyar. She's a cornea and refractive surgeon at Lions Sight First Eye Hospital. Thank you so much for creating time for us, Dr.
Thank you so much for having me here.
Yeah,
it's a pleasure.
Yeah, so today it's all about eye health, and I was just looking at some information that was estimating that half of the visual impairment and blindness cases can actually be prevented through early diagnosis and treatment, the right treatment at the right time. But there is a bit of lack of information about some of the things that people do in terms of their eye health and taking care of their eyes, and even the options that are there in terms of interventions when it comes to the conditions of the eye. And that's why we are having this conversation this morning. And it would be a good point to start with you, Daktari. Just to understand, I usually like starting from the very basics on this program.
Yeah. That's true.
Every organ we talk about, we want to understand, like when it's perfectly healthy, how it's structured and how it works, and when there's a condition affecting this functionality, what exactly is that? What condition?
Exactly we are looking at.
So let's begin with the eye, and I'll just call up that picture, that the photo that we had, to help us explain, how the eye is structured,
how the eye looks like,
and how it works, and how it,
and what are the names of the structures.
Exactly.
When we are talking about what part of the eye is being affected, and we don't know what is the main function of that one and how it looks, we might be in the dark that what we are talking about.
Yeah.
So it's a good thing to start with how the eye looks first. Yeah.
As we wait for that photo to be brought up, so that we can be able to see what Daktari is explaining to us. Yeah. So like I told you, we're talking about eye health. So if you have any question, you want to understand something you have been going through with your eye, and you want to understand anything that you're curious to know, you can actually just send in that question, and Daktari will be able to answer those before we conclude this conversation. But for now, let's have that picture, and then Daktari, you can just run us through. This is actually how our eye looks like, and these are the different parts. So tell us, what are we looking at?
Yes. So this is basically what we, in medical terms, call the anatomy of the eye. Mm-hmm. Yeah. So as you can see on the left-hand side, there is a camera. What does the camera do? It catches a picture,
the image,
and then we see the image, right? So the eye basically works like a camera, but this image then goes to the brain to interpret, right? So it's the brain which interprets the image. So if you are seeing there, the outermost layer of the eye is the cornea. It's the most transparent layer of the eye, and through which the light enters the eye. It's like a window, okay? So behind the cornea, then there is a lens. It's structure in between there, and after that, vitreous, and the retina is just the globe you can see behind, behind the orange thing, there is a globe there, It's like a circular thing, that's the retina, okay? So, and behind is the end part is the optic nerve. So whatever we are seeing, the information goes through the optic nerve to the brain to interpret, right? So the light falls on the cornea, passes through the cornea acts like a window, then goes through the lens, then the vitreous, falls on the retina, then the optic nerve carries the image to the brain. Yeah.
And then it is interpreted.
And then it is interpreted.
It's a tree, it's a car. So that's what now happens there.
So for us to see well, all of these structures should be doing well. There should be not any pathology in any of them to see well. Okay.
So when you're talking about vision loss, so in the context of what you've just taken us through, So what are we exactly, talking about when you say somebody's losing their vision?
Yes. So you can say what is a normal vision? Normal vision is 20/20. Okay. For somebody who is standing at 20 feet and another person who is standing, a normal person at 20 feet, who is able to see the same thing clearly, we call it as a 20/20 vision or 6/6 vision, okay? So that is a normal vision. Vision impairment is a vision lesser than that, okay? It can be due to multiple reasons. The most common cause of the visual impairment in the world is, you can count like refractive error, then glaucoma, cataract, ARMD, that is age-related macular degeneration, diabetic retinopathy. These are the most common causes, but there are others as well, which can start according to the age we are looking at, right? If you look at a child, there might be other reasons, there are other diseases that affect children at a particular age group, then an adolescent, then adult, then as we grow older, there are other diseases that come through.
All right.
Right? So each and every age group has different patterns of diseases and as well as different comorbidities that affect the eyes.
All right. I'll be keen to know whether age has something to do with causing some of those conditions, but later. But how common eye conditions, before we get to Vivian, just tell us, how big of a problem is it in terms of the people who are actually managing different, eye conditions out there?
Yes, if you can say, each and everyone is facing some of the other issues in terms of the eyes. And refractive error is the most commonest. You can say myopia is becoming like an epidemic. Post-COVID, it has amplified a lot. As you can say, in this era, it is a digital era. More of digitalization has happened. And due to that, also the mobility has reduced. Comorbidities has increased, and for children, the near work, the digital screen time has also increased. So all of this has brought around different issues, particularly in children. If you talk about the refractive errors, the refractive errors,
very common among
yes,
children.
Yes, amongst the children, very much common nowadays. So that is what I'm saying. Myopia is an epidemic. All right. Nowadays.
When you say myopia is the
nearsightedness.
Yeah. Okay. I told you I'm very basic on this program. So
yeah, definitely. We'll go to the basics
to
as
understand
I told you.
Everything.
Yeah, we'll go to myopia as well.
Yeah.
As we go further.
All right.
Yeah.
So Vivian, tell us a bit about yourself, because for many who may not even know, you actually understand where this shoe pinches, and it is something that caught you in your adulthood. Yeah? So just for us to understand a bit of, what exactly that journey has been like for you, just run us through. And I'm glad that actually at the end of this, by the way, she's doing an amazing thing with what she's gone through to help others who are battling different conditions. But let's start from where it all started. What really happened?
Apparently in 2020, when COVID was starting, I became unwell. Then I went to the doctor by myself. I was just okay. But by the time I went to the doctor, I had lost most of my sight. So, but I was told to go somewhere else for further help, and I did. In the end, I lost sight in one eye completely, but the other one is, let's say I'm seeing at 20%.
20%?
Yes. So for now, I'll just say for now I'm seeing at 20%. So it has been really a journey.
So what you're going through is low vision?
Yes, it is low vision. Yeah, so I went for clinics to curb the other eye from losing its total sight like the other one. So in the end, I started going for a low vision clinic to see if there's anything that can be done so far. And that is why I have met a few people who are going through the same thing, so that we can learn and help each other from there.
Before you get there, Vivian, so it's 2020.
Yes.
You are seeing perfectly.
Yes.
All along since you were young.
Yes.
You're working, living your normal life. So what happens? Like just that fateful day that things just turn from you are seeing and now you're beginning to lose your sight. And was it drastic, or was it like something that was progressive?
I believe it was progressive, because in 2018 I had gone with my family for Christmas holiday. But in the midst of that holiday. When I woke up one morning, my eyes were so red, but I just thought it's because of the sun. So we went and got some spectacles for that. So I think it started from there, but in 2020, I think it's when it all unraveled because it was not taken care of immediately.
So from 2018 to
2020.
2 years.
Yeah,
almost.
2 years. Because in January 1st, I remember it was someone's birthday, so we went and I was okay. I could see, I could do anything. Then when we resumed office, in the morning I was okay. I chose, even from colors, I could see everything. And I went to the office, but when I sat on the computer, I just opened and it was so blurry, I could not see anything.
Just suddenly?
Suddenly. So I went to the hospital by myself, but by the time I got out of the hospital, it was even worse. I could not even cross the road, so I had to listen. And if there's any car that is coming.
So you were moving by the sounds around you, so you couldn't see?
I couldn't see, and I was also moving from memory because I knew the area. Yes. So I was walking by memory and by sound. And I crossed the road and I went home because now from where I stay, they could not take care of my situation at that time.
So I'm just wondering, between your office to the hospital, you're losing your vision minute by minute. It's getting worse.
Yes.
You get to the hospital, what do they do and how do they allow you leave without proper vision?
Actually, they were like, sorry, but we can't help you here. We can just send you somewhere else because we don't have the necessary equipment.
Facilities.
Yes. So I was just told to go to a certain hospital. And that's what I planned to do. So I went home because now I could not see my phone. I couldn't call anyone. I just took courage and I said, let me just go.
Let me go. And in the morning you were perfectly fine. You were seeing your phone.
Yes.
Now you can't.
Yes. So I went home and I waited. Then in the evening, we planned on how to go to the hospital, and we went. And actually, when we got there, we were referred again to another hospital. So when we got to that hospital early in the morning, there were so many people. We were there by 6. I was actually number 70-something there. So we had to wait. And eventually when I saw the consultant, he said, this one is a serious matter. We have to go to my clinic the next day because he was just consulting for that day. Because he was not able to come to that same hospital the next day, I had to go to his clinic. So I went and immediately we started injections in the eye. It was the first time I knew that you can get injected in the eye. So yes, I started injections.
And it's not easy,
It's usually not.
Just even a hand next to your eye, you don't want anything next to it. Now you can imagine a needle.
Yes, it was scary, but eventually we did the injections, and yes.
So at this time, what is the diagnosis, and what are you trying to treat or with the injections?
The injections we were told that it's a macular degeneration, and they had to take care of that. So we started doing injections. It was stemmed from what's the name?
Have anything comorbidities, anything because of that?
The main cause for macular degeneration. So that is why they were doing injections. Yes.
Okay. You know, right now you talk about it as if, you know, you've mastered the art. But I'd like to know how you transition from, you know, for somebody, I'm not saying it's easier, but somebody who was born blind, they already begin to learn that at a tender age.
Sure.
But this is somebody who acquires this in adulthood, and you can already imagine how that transition looks like from you seeing and there was light all over around you, and then now you're beginning to lose your vision. I'd like to know how that went for you. But Daktari, just having listened to what she was sharing, what can you pick in terms of even the diagnosis and the challenges that we have out there, the lack of facilities, and even just from her experience, what are your quick thoughts about, you know, this challenge?
Yes, so what I gather from her experience that she needed specialty care. like the issue was in the retina. That she started gradually, the vision started reducing gradually over the 2 years, and then started deteriorating more past 2020. So what we look in these conditions is, are there any other comorbidities? We'll try to look into the cause, that why this happened, because treating the cause is as good as treating the disease eventually. You know, if you don't treat the cause, then it will keep on worsening further. So we need to investigate first what might be the reason that this thing happened, first of all. So we go into that thing, then certain tests are also done. I'm sure she must have done those tests as well. We do some scanning of the retina, there is an OCT, angiography. All those things are done to see if there is any leak, any bleed, any blockage, or to look at if there is any swelling on the macular area, so, and any new vessels growing anywhere. So accordingly, what we are getting the results, it's treated that way. So as she's saying, she was given injections. Probably there must be some swelling on the retina or macula, or there might be some bleed somewhere which further caused the swelling there. So that to reduce the swelling, she got those injections probably.
All right. And then that loss of vision that just happened from 1 minute and it's getting worse. Is it something that's common, and just run us through how it happens and some telltale signs that somebody can use to help them realize that something is actually going off with my vision and I need to quickly run to the hospital?
Yes. So see, if your vision was better before and something is happening there, definitely you know that something is going on. Yeah. So looking at the cause is very important, and what is affected. Is it cornea? Is it the lens? Is it the retina? Is it the optic nerve? Because sometimes you get optic neuritis as well, which causes sudden loss of vision. Optic neuritis is inflammation of the nerve, the optic nerve, right? So that also can cause sudden deterioration of vision. Sometimes our child has keratoconus, they can develop sudden hydrops. In one eye, hydrops is swelling of the cornea becomes completely white. That also develops suddenly. So that child might also come with a history of sudden blurring of vision that way. So even some of the diabetic patients who are uncontrolled, they also develop they have some ongoing diabetic retinopathy, which is initially not detected because sometimes they don't come for screening, routine screenings, and then they bleed there as well. So that can also cause sudden bleeding and loss of vision there. So the history of trauma, we need to look into minor injuries.
So you go case by case?
Case by case, yes. Evaluation and history taking, case by case is very important.
All right.
So this is when you come, when you're experiencing loss of vision, that is definitely you come whenever it's a minor thing also, don't wait for it to get worse, right? Because something which can be treated at a lower stage or early stage becomes a bit difficult when it is in the advanced stage, right?
Yeah. Is loss of vision like the only sign to really check whether there is something wrong, or
the other signs
I could be having a problem with my eye without necessarily losing my vision? Yeah.
Yes.
Let's talk about that.
Yes, there are other signs also. You know, the field loss. Sometimes you have a field of vision. So one eye has 180 degree. Okay. So this field of vision can get reduced also if there is a detachment in the retina. So partly you can see that one half of my field I'm not seeing, okay? So you'll say that a patient might turn up saying that this part I'm not seeing since some time, since 2 days or 3 days, suddenly it got dark, right? Some patients might say that there are some floaters coming, okay? Floaters are something flying, they see something flying there, and the lower part I can't see. Can be a bleed there which has settled down, and some part is like a floaters there, right? And other signs also, glaucoma gets undetected most of the times. What happens, if you have a very high pressure, of course will come because of the pain. But if it is a borderline high, we might not know if the eye pressure is high unless we go to the doctor for a routine screening and he checks the eye pressure. So that causes silent vision loss. And how is the vision loss happening? It is tunnel vision. The vision is reducing from the sides.
So you can see, but
central vision is okay.
Yeah, but the
peripheral vision is going, right? So you will not notice that your field has reduced this much, will you? You might not.
You might not.
Yeah, so slowly, gradually it's getting affected there, right? So these are some of the signs also we need to look at, not only the central vision loss, but other things also. That way.
All right. Vivian, just run me through how the initial stages were like for you, trying to learn this new lifestyle. What was the hardest part about it, the low moments that you had, till you got to that point you now try to at least find a way of navigating, and what that season of your life taught you?
Okay. Losing sight is like losing a loved one.
Yeah.
Because this is part of you you've been with since you were born. So it's...
losing sight is like...
Yes, losing a loved one. Yeah.
That's powerful.
Yeah, because... and then it takes you like grieving. The same way you lose a loved one, you go through the grieving process. So sometimes you're angry, sometimes you're... Just the same way you grieve when you lose someone is the same way you... Yes. So it took, and it does not end, because sometimes you think you're okay, but you get to a certain place, it hits you. Something happens and just reminds you. So you go back and you're in another cycle. But eventually you learn how to overcome it and to encourage yourself. I think also your EQ needs to be built, because it is an emotional roller coaster.
So your emotional quotient has to be.
It has to. It grows with time, because now you need to learn how to overcome certain situations, like social engagements.
Like, how did your life turn around? What are some, when you say things changed,
like
what changed?
Certain things like how I operate. Because I used to, the freedom of independence. I could take my children out to play.
Wow.
I take them anywhere. I read books, but now it is limited. I have to download some books and do e-reading. So you see there's a difference. But now you have to learn how to navigate. But thank God for family. They help me to walk around and do certain things. But even at the workstation, you need people who can support you in your work. I'm an office admin, so you can imagine most of my time is spent in front of a computer, and I have to learn how to manage that. So I have learned how to navigate that by changing a few settings here and there. Yes.
So everything has to change from home to work, to even your social space.
Yes.
But then what did you learn, in this season about some of the things that we need to change, the structures that we need to change in our offices, in our homes, to just help people who are dealing with different disabilities to cope? I'm sure before you experienced this, maybe that was something you never thought about.
Sure.
But now, going through this, losing your sight and having to navigate at the same time, what did it teach you about the things that we need to change?
From what I have gone through, I think we need to change how we operate, how we do our systems, because we have rehabilitation centers for people with drugs issues, but anyone with vision loss, like what I went through. You see, when I went to the hospital, after that, I was just left to cater for what I need. But we need somewhere like, I follow, there's a certain lady I follow, she's from the US, and their systems are pretty good. You are taught how to even use the escalator, how to use the white cane, they even come to your house to show you how to operate things in the house. They give you information on systems that are available for your use in the house or when you're walking outside. They show you how to cross the road. I can assure you, if we had that in Kenya, many people say that the cemeteries have a lot of potential that is lost. And we forget that in those cemeteries there are also PWDs. But if we don't tackle their issues, many people are at home because they don't know how to come out.
So there's a lot of potential.
Yes.
What you're saying is there's a lot of potential in persons with disabilities that has been locked in houses because they don't know how to come out to the outside world. They don't know how to survive and navigate the challenges that are out here. So they stay at home, they stay in their small corners of the world with their potential that they have. Wow.
If the government had an office, like we have a rehabilitation for the juveniles, but if we had such a kind for PWDs to help them to assimilate in the offices and do every other thing. I don't know how many people have been to any office and they have seen PWDs, especially with visual impairment, working. Very few.
Yeah,
it's true.
That's very true. There's a big gap.
Yes.
Yeah.
So if we could help people to assimilate and to know how to work in their specific areas, because you see, when I started, when I got the vision loss, I had to learn how to operate.
How to operate.
On your own.
On my own.
Your own.
Yeah, but it reached a time I was asked, do you want to move to somewhere else? But now where do I move? You see? It just needs you to learn again.
All right.
Yes.
So what I'm getting is what our focus in terms of intervention is the medical side of trying to deal with whatever condition that is at stake. But we have not invested in teaching this person the new life that is facing them with this condition that they have.
And rehabilitating them in the new world and giving them new opportunities.
Is that part of you know, what is captured in the interventions you do, or it's still a gap that needs?
You see,
after a patient comes, you've given them their diagnosis, whatever it is, the stage or the level it is.
At some point, they do try.
Go the extra mile of telling them what's ahead and how to,
At some point, they do help, you know, in terms of what can be done to improve the vision and what can be done for, you know, low vision aids can be given according to their needs, you know, magnifying glasses and lenses that way. So also some of the apps are there which can help to read out through the computer and all those. So which can help you to listen and interpret if you're not able to read, and also you can speak and it will type for you. So there are some of these things which are there which have come up. So these things can be looked into, but you know, particularly assigned person for all these things, we need to have that department there.
That's what you're saying, a rehab, or some sort of...
Some people do help. We do help some of them. Some of our staff also helps for that purposes. But for all the patients, it might not be possible that way. So that's a very good idea that she has come up with, because, you know, this is, they still have all of this potential that they can be utilized, or they can be pushed in a particular thing. So they should be also being given the opportunities.
If we have correctional facilities,
new opportunities, you know.
If we have rehabs for people who are dealing with drug and alcohol addiction, if we have mental health facilities for those who have mental illnesses, why can't we have rehab or some sort of facilities that people who are dealing with... We do have
counselors there which help in emotional counseling and all those, and future discussions for that. We do have at Lance.
All right. So let's talk about the different conditions that cause vision loss. Just run us through, as we call up those pictures that we had from myopia.
All right.
I'm seeing hyperopia. There's the different conditions that...
these are just the refractive errors there. So this has come up with the picture there. This is for the correction. Okay, so let's stop there, or we can have the previous picture.
We can have the first one, the myopia. Just the nearsightedness, just to explain what this looks like and the challenge that it gives, people. Maybe you can just begin explaining, Daktari, and just telling us through the difference between myopia and hyperopia and the difficulties that it presents. As we try and fix that.
All right. I think if it is coming, it's okay.
Yeah.
Otherwise, in myopia is nearsightedness. The rays of light, they don't focus on the retina, which should normally be focused, right? So, do we have it?
Yeah, we have it. It's being worked on. So as we wait for that, you can just explain it to us. Yeah.
And then hyperopia is farsightedness there. There is astigmatism, which can happen because of the abnormal curvature of the cornea. All right. Yeah. So here, what we are seeing, are we seeing that on the slide? That one?
We just
not yet.
Not yet. But you can just explain to us what maybe causes myopia. This is myopia. Yeah. So
yes.
we have myopia. So, can just run us through.
So this myopia is nearsightedness. We are having difficulty in seeing the far objects clearly, right? The rays of light are focusing in front of retina instead of focusing on the retina, right? So go to the next one.
Yeah. So the hyperopia.
In the next one, the rays are focusing behind, as you can see. Yeah. And the third one, that this is presbyopia. Now this is another refractive error which comes in after 40 years of age. You know, normally what happens, the eye muscles concerned with readings, they starts becoming weaker with age. So we need reading spectacles or reading glasses as we age further. So this is what happens in presbyopia.
All right.
Yeah. And then there is astigmatism, wherein due to the different curvature of the cornea, there is astigmatism coming, that is the cylindrical power in a particular axis that comes. So all these refractive errors are nowadays very much increasing, particularly in children, you know, because of all the behavior changes that is happening. With more screen time, more near work, more stress in the, what you can say, academic achievement that they want. So they have doing more school time, doing more work at home. So outdoor activities have reduced in a way. So there is a Sydney myopia study which says that the more the near work the children do, the more the chance of them becoming myopic in the future. So especially WHO has recommended that the screen time or the near time, that should be reduced in less than 2 years. There should be no screen time. In 2 to 5 years, you can say up to 1 hour, and 5 to 12 years, maximum 2 hours of screen time.
All right. So now that you've begun talking to us about some of the lifestyle issues that
has come up,
there were questions around watching too much TV, whether that can cause eye conditions, and the people who work in the office setup and they are in front of their computer most of the time. What would you tell them? What are some of the safe habits that they can adopt to be able to take care of their eyes?
Yeah, correct. So first of all, what I would say is regular eye checkups is very important. Yeah, particularly the checkup starts from the birth of the child. Then at 6 to 12 months, third one is at from 3 years age. Yeah. So early detection of any refractive error is very much important, and correction of that.
So when you say regular, what do you mean? Like how?
Yeah,
like recommended after how long?
Yeah, so that's what in a child at birth, it starts at birth. The pediatrician or the neonatologist grossly looks at the eye, right? Then between 6 to 12 months. Yeah, if there is no other condition that the child is suffering from, like prematurity and anything is not there, then it is a routine checkup between 6 to 12 months of age. After that, at 3 years of age. Yeah, so then if it is like everything is normal, still two yearly checkup has to be continued until the child is 18 years age there. Okay, because some of the refractive errors tend to develop with time. Right? Yeah. So this is the checkup, and in the adulthood, if there is nothing wrong, then maybe 2 to 3 yearly until 40 years. After that, 2 yearly checkups, you know, has to be done as such.
So at least 2 years.
2 years.
Annual checkups if you can
have
manage.
Glasses, then you need to check yearly. If you're suffering from anything there.
All right.
Yeah. The other thing you were saying, lifestyle modifications. Yeah. So for a person who is working on the screen all the time, like it's so common here nowadays, you know, everybody almost. We also in the clinic, we are always typing also for the
phone. Or
definitely. So that's very common to have a digital eye strain or computer vision syndrome, right? So all of this can cause headache, eye strain, then dry eyes as well. Also neck pain, that way neck and shoulder pain, because of the posture. Yeah. So what we are doing is we are scooping down, or we are not having a proper back support there. right? So it's very important to have the screen at an angulation below the eye level, 15 to 20 degrees below. Also, when a proper back support is important, sitting properly there. Whenever you are using any curtain or windows there, light should not fall directly, so there should be no glare from there, so that we don't have any sensitivity coming from there to the screen there, right? Also, there is a rule that we follow, 20-20-20 rule. So after every 20 minutes of screen time, you focus at something which is 20 feet away for 20 seconds. This is for your relaxation of the eyes. You know, you're looking at the screen which is near. Now, this screen also should be around 20 to 25 inches away from you, at a lower eye level, below your eye level there.
I don't know how long my director has been looking at that screen, that computer screen, and whether she's going to take a break and look at something else for 20 seconds.
Just for 20 seconds, you know, it relaxes. You know, when you're focusing at something quite far, it is relaxing your eye muscles which are concerned with reading, right? So that is very important to reduce the eye strain. And blinking, you know, when it causes dryness, whenever you're focusing at something, your blink rate reduces, right? So that causes the dry eyes. So always try to blink more, or whenever you remember, close your eyes for a few seconds that way.
Vivian, you think there is a challenge of lack of awareness about the general health of the eye, and you know, what people know, like what even Dr. is sharing is something most of us are learning, So just run me through what you knew before, and whether you were regular of going for annual checkups before you went through this, or this new lifestyle has actually given you a different perspective about how to take care of the eye.
It's actually interesting because we have a medical cover and there's an eye checkup that you can do, but we rarely use it. I had never used it.
You had never done it before.
Actually, I didn't even remember that I had it. But now, even when I went, in 2018, when I went for that checkup, I didn't even go to the hospital. I just went to a place where they sell spectacles. And they just checked, they said, you need this. You see, I didn't even get a proper diagnosis. So we take these things for granted, like we don't think there's much that can happen because now I can see. So if I can see now, what's the problem? We don't need checkups. So if I believe if we take this seriously and we do regular checkups, as Dr. is saying, many of these issues will be dealt with earlier on. Because I think in that 2018, if I went to a proper hospital, I would have gotten the diagnosis early. And probably this
a good treatment on time.
Sure. So I think most people don't even know of situations that can occur if you don't take your health seriously. And you know, most of these things that happen are also based on your lifestyle. Lifestyle changes also matter in this issue. Dr. can say that the things that we use, the things that we do, like vile anasema the computers, I didn't even know that you need to put it 20 and you have to look 20 and
just
do
now?
another 20. Just now. If most of us knew, we will take it seriously and do those 20, 20, 20.
Or just take a break and walk. You know, you can just take a break from the computer and take a walk around the office or step outside.
The only break we take is for tea and a few gossips here and then we come back and sit the whole day. Yes.
All right. So let's talk about the interventions. So when somebody comes to the right facility, like she said, she went to some people who sell spectacles, but the recommendation is if you're having an issue with your eye, go to the medical facility.
Medical facility, definitely.
First. So what should somebody expect, and what do you use to, for example, recommend spectacles, contacts, and the likes?
Yes. See,
and
first
just
of all,
medicine.
Just medicine, okay. So whenever somebody comes with a vision issue, first of all, we need to see in the slit lamp that is there any abnormality we can see grossly that is affecting the eye. Then also we are checking his nerves, optic nerves, eye pressure as well. then the patient goes for a refraction, that is glasses power check. Okay, if his vision is improving with glasses completely, of course he or she needs glasses, right? But if there is something affecting his eye, the vision might not improve. Okay, so we need to look at the reason now. Why is it not improving? Sometimes even if the vision is improving with glasses, there might be some early diseases which are not being detected. If you just look at the glasses prescription, like if there is astigmatism, okay, we are seeing there is astigmatism, that is a cylindrical power coming, which is also the keratometry is a bit on the higher side. You will not notice looking at just the glasses, vision is 6/6 or maybe 6 spots, but if you do a topography test, it's an early keratoconus. Okay, so now these patients are going to worsen with time, right? Because keratoconus tends to progress with time, right? Especially in children. So when we are detecting it at an early stage, we do a follow-up of this patient and we see that it's worsening, then it can be treated at a very, very early stage instead of that patient coming when his vision is now affected and not improving with glasses. In that situation, we advise a hard contact lens, can't be done, a cross-linking, needs a transplant. So all these things happen. So early checkup and detection is very important. So whenever they are coming, it's not only we are looking at whether the vision is improving with glasses, is there any subclinical condition also, which is there.
Let's talk about the contacts now.
Yeah.
What should we know about them in terms of then? At what point do you prescribe them and taking care of them? I've had cases of having infection because of the contacts.
Because of the contact lens.
Or irritation. Let's just talk about the contacts and what we need to know about using.
So there are different types of contact lenses, okay? There are soft contact lenses, hard contact lenses. In hard, there might be RGP, scleral lenses, or rose-K lenses. So there are different types of lenses. So depending on that, like we have a simple refractive error, glasses prescription with myopia or something. Then we are using soft contact lenses. It's just like an alternative to glasses that you're using. When you don't want to use glasses, you're going for contact lenses, right? So these contact lenses will help you to see as good as you're seeing with your glasses. If your vision is improving with glasses, it will also improve with your contact lenses, all right? It's just a cosmetic thing that you are doing there, right? But there are other types of contact lenses which help in vision also to see better than you're seeing with your glasses. Those are now the hard contact lenses. These lenses are prescribed for patients with keratoconus or patients who have astigmatism post-graft surgery, which can't be improved with glasses. So what happens is now these hard lenses sits on the cornea and they give a smooth regular surface. So these patients have a vision which is much better with the contact lenses, almost clear compared to glasses.
All right. What causes infections? And
so now what happens is we should not have dry eyes. First of all, when we are having contact lenses, if you have severe dry or moderate dry eyes, it's better not to use them also. So infections is like you're not taking proper care, right? We can get a daily disposable. If you're using just occasional contact lens wearer, use a daily disposable. Or better, that is still better because you are just throwing that out. Once you're wearing once, you're throwing that out. I'm talking about the soft contact lenses, right? Then you get monthly disposable also. But when we are using them, the solution, you have to clean the lens, definitely. First, clean your hands. Your hands should be clean. Then you take the lens, take the solution, clean the lens also properly because there are protein deposits or something which accumulate there. You clean that as well, get rid of that. And then when you put properly in your eye there. Okay, so if you're not using and it's a monthly disposable or yearly disposable, you have to keep changing the solution.
All right.
Okay.
All right. I'll come back to you for the final remark. We unfortunately run out of time, but Vivian, tell us a bit about how you've turned your story to something purposeful that you're doing right now. Just tell me what area of advocacy you've gotten into.
From my experience, I have noticed there's a gap in how people get to walk around and do whatever they need to do on a normal basis. So I'm in the process of starting an organization, but currently dealing with a few people here and there, helping them and quite literally opening their eyes to the options that we have outside here. There are certain apps that are available for our use. Actually, I didn't know that Alexa was made because of the visually impaired, but now people use it on a daily basis. But that was the basis of doing Alexa. So we have so many options, but apparently many people don't have smartphones, so they are not able to come across such things. So for my organization, I am planning to help people also adjust mentally, emotionally, and actually on their accessibility, to know how to walk around with the white cane and any other systems that are available outside there.
You're telling me you're still learning how to use the white cane?
I'm still learning, actually, because I didn't get anyone to teach me. So I'm still learning, and actually I found a place where I'm going to learn how to be a trainer of trainers on accessibility. So we can give people options on whatever that is available. Actually, I didn't know there's an expo where people showcase the latest technologies in regards to accessibility for persons with visual impairment. So that is an area that we are working on to reach as many as we can, to help them navigate the issues of life. Because, you know, this can bring someone mentally. If you can imagine a person who actually has all the 5 senses and they get depressed and they can even lose their lives, or they get mental issues. What about someone who has visual impairment, or is just a PWD, who has been given an extra card, who has been dealt with an extra card? Now they have to deal with an extra thing.
It becomes worse for
Yes.
All right.
So now we are just opening the door for PWDs or visual impairment.
Thank you
people.
so much. All the best with that. All the best with
Thank
that.
you.
Hoping that it will reach as many as possible, and that some will have it easier than you did.
Yes.
Daktari, your final remarks as we close the program. Maybe just what are some of the things, tips or whatever it is you want to leave us with in terms of how to better take care of our eye?
I would suggest a better healthy lifestyle. Starts with the diet as well. So have a good healthy diet rich in vitamin A, C, E, K, omega-3, gluten, zeaxanthin. So all of these will come with the green leafy vegetables and all those carrots and fruits and all. So that will help in all taking care of the eyes. And please get a regular eye checkup done, okay? That is most important, to detect the conditions earlier and at a proper time, so that they can be treated well.
Thank you so much. There's a lot that, you know, we could talk about when it comes to eye health, but at least we have guided you on what you need to know and how you can be able to act swiftly in case you're facing any challenge with your eye. The earlier the better. Actually, when I told you, half of these conditions can actually be prevented if you get the right diagnosis at the right time and the right treatment. So the earlier the better. I will insist on that. Dr. Priyanka Buyar is a cornea and refractive surgeon at Lions Sight First Eye Hospital. We've also been having Vivian Selena, an empowerment coach, and thank you, Vivian, for coming and sharing with us your story with you know, just managing vision loss. And thank you so much also you for watching. We want to end it there. Enjoy the rest of your day and enjoy the rest of your viewing.